Dear friends, dear fellows and member of the ITI, I'm very happy to be here with you today to speak about peri-implant soft tissue integration and management. This is the title of the ITI treatment guide number 12 I wrote with Tony Scullion. And I want to start from the conclusions of the book. You will read that osseointegration is simple, soft tissue integration is difficult, long-term maintenance is complicated. And today we will concentrate on the importance of soft tissue integration. Why is that? Because for many years we've been thinking and talking about osseointegration. And if you look at these implants, all these implants are osseointegrated. But of course, as you can see, they have big problems. Because at the end, what patients want, what's really important, is the integrations of the soft tissues. Not only in the aesthetic areas, but even in the posterior areas, in the area which are not aesthetics. And if you look at these two implants, you will see again that both of them are osseointegrated, but of course the situation is very difficult. On the right side, you have a perfect implant surrounded by a nice band of keratinized mucosa with no inflammation, no bleeding and probing in a healthy situation. On the left side, you will see an implant with, of course, bone loss, plaque, and the keratinized mucosa, which is absent,